Bedlam Clinic is an amazing place where our medical students, under the supervision of our School of Community Medicine faculty members, see patients who otherwise would have nowhere to go to get health care other than the emergency room.
Usually that means that they are either unable to work because of a health condition, or maybe they are the working poor, but they make 1 or 2 paychecks. You work a few hours of overtime, all of a sudden you're over the barrier for qualifying for Medicaid.
Sometimes you'll see individuals that are in between jobs, and you know how sometimes you may have to work for X number of days before your insurance kicks in.
I've been living in Tulsa for a very long time, and I did not know places like Bedlam existed before we started volunteering there as nursing students.
Third year, fourth year medical students and PT students, along with nursing students actually, all have an opportunity to practice working as a provider while also being a student.
We're really empowered to be their student provider. We get to go see the patient, we get to develop our own assessment and plan, and then go to our attending with that and really care for these patients like they're our own.
What's very interesting is that over the entire time I've been here, almost 10 years, if you ask our medical students, what is the best part about getting your medical education at the School of Community Medicine in Tulsa, they will say the Bedlam experience.
When I think about patients that we have taken care of, it gives me a great feeling. It gives me a great feeling.
They don't know you, they don't have anything really specific on you, but they're helping you because that is what they're trying to do. They're not worried about what's behind you or before you. You are in front of them, they want to look after you, they want to make sure you're safe. They want to make sure you have medication if you need medication. They want to take care of your pains if you're having pain.
But I think at the end of the day, my favorite part of Bedlam has been seeing how much it gives hope to our patients. I remember my very first patient during Bedlam Evening Clinic, my 3rd year. He had gone 4 years without any health care and had very uncontrolled diabetes and almost every complication you could imagine. I'd come in and I was like, we're gonna get you started on insulin, and here's what I'm gonna be able to send you home with today. And he said, no, I can't do that because I can't pay for that. I said, here's the thing, free of cost, we're covering this for you. Here's your follow-up appointment, here's what we're gonna do. And he just breaks down crying. And he said, for the first time in a long time, I finally feel hope.
It makes me feel very good to know that this clinic, one, has been there for many of the Tulsa, residents, and 2, that it's still in existence. Not many free clinics can sustain themselves for as long as Bedlam has. That's a statement to, our Tulsa community.
We've always been the recipient of very generous gifts from charitable organizations in Tulsa. And so we are very thankful for the generosity of all of our donors who have made possible the continued success of the Bedlam Clinic in perpetuity.
It's what I love to say about Bedlam Clinic is that really we get to be hope dealers to people in our community, and it really is a physical representation of what our mission here is at the School of Community Medicine.